Morning, everybody. Bore da. My name is Sian Cartwright, and I'm a National Officer with Wales TUC. First of all, can I thank you and welcome you to the Welsh Health and Safety Reps briefing on COVID and COVID safety. Diolch a croeso. My colleague Flick is posting information in the chat box about our approach to running meetings, and I'd be grateful if you take a look at that. To say something about the purpose of today's event, what we're going to do is to provide information to you as health and safety reps and other kinds of reps who are also attending today about the steps that you can take to make your workplace COVID safe now that Wales has entered alert level 0. Since Saturday, 7th of August, specific COVID safety regulations have been replaced by a lesser requirement that employers take reasonable measures instead. And one thing that I'd like to do is to thank you all as health and safety reps for doing an incredible job of keeping Welsh workplaces as safe as possible during the pandemic. But not only during the pandemic, every day of everybody's working lives, we know that where health and safety reps are present in the workplace, those workplaces are safer. Okay, today's meeting is going to feature 3 short presentations about the current position on health and safety in COVID. Then the most important part of the meeting, I think, is where we get to hear from you about your experiences and to hear your questions to the panelists. It's a two-way conversation, basically, and we are really, really keen to get your thoughts. You're very welcome to post questions and comments during the meeting, and we come to those later on. And we welcome contributions in Welsh, and my colleague Kerry will be able to translate those for us. Our first speaker probably needs little introduction to you. It's Shavanah, our Wales TUC General Secretary, and she's going to speak about very recent changes to COVID guidance in Wales and areas of particular importance within that guidance. Shav's also going to talk to us about how unions work in Wales with Welsh Government, with employers and with enforcement agencies to ensure that the worker voice is represented in decision making. Then after Shav, we're going to hear from Doug Russell, and Doug is the National Health and Safety Officer for USDAW. And the USDAW, as most of you will probably know, is the Retail and Distribution Union. Doug is the health and safety specialist for that union and a member of the Union Health and Safety Specialists group. And we're very grateful to him in Wales for the support that he gave us very recently in responding to the Welsh Government draft coronavirus guidance. Doug is going to talk about how he sees the role of the health and safety rep now and looking back to the height of the pandemic and how we responded. In particular, and I think this is going to be really important for us, he's going to consider what health and safety reps should be pressing for now, both under the guidance and in the longer term, in the wider health and safety legislation. Finally, last but not least, we have Shelly Asquith, and Shelly is the TUC's Health and Safety Policy Officer, and she's going to consider some of the wider issues relating to COVID and safety, which the TUC has been campaigning on nationally, including the level of statutory sick pay in Britain. So, thank you very much for listening to me. I'd like to turn now to our first speaker, who is Shavanah. Shav.
Thanks, Sian. Bore da everyone, croeso, good morning and welcome. I want to start by thanking you as our health and safety representatives for the role that you are continuing to play, this extremely important role in keeping our workplaces safe, particularly so during the period of the pandemic. I also wanted to just sort of set out in terms of what it is that I will be speaking about today. So today I'm going to talk a little bit about the new Welsh guidance on the coronavirus safety in the workplace, and to talk about Wales TUC's engagement with the Welsh Government and others on health and safety. So the new Welsh guidance came into force, you would have seen, very early in the morning on Saturday. Over the weekend, employers are now required to take reasonable measures in order to protect workers and the public from coronavirus based on the results of a risk assessment for that workplace. And for the most part, the Welsh Government is no longer issuing mandatory requirements on the precise measures that need to be taken across the board, except that face covering should be worn in shops, public transport, and in health and social care settings. Furthermore, the Welsh Government still requires that businesses maintain the 2-metre social distancing indoors, and we welcome these rules, which reflect the Welsh Government's careful approach, which will help to protect people. So the reason for lessening the COVID restrictions is that there is a significant amount of research now that we've been following very closely and carefully that shows that the link between catching COVID and then having a severe illness or dying is far weaker than it once was, thanks to the vaccine programme and the amazing work of the NHS workers in rolling that out here in Wales. But nonetheless, COVID is a contagious disease, so it's right that we take steps to ensure safety from the virus at work. And as unions, we're pleased to see that this new guidance has a very clear emphasis on the importance of good ventilation in workplaces. On Wales TUC's request and some of the lobbying and negotiating that we've been doing, the guidance does very clearly now refer to the legal requirement under workplace health, safety and welfare regulations that effective and suitable provision shall be made to ensure that every enclosed workplace is ventilated by a sufficient quantity of fresh or purified air. We also welcome the fact that there's a clear reference in the core guidance to the importance of trade union reps' roles as well as far as the risk assessments are concerned, and they should be involved in good time when risk assessments are being produced. However, the guidance, the advice to inspectors isn't yet clear that they should work with trade unions when inspections are taking place. So that's something that we early this week, continue to press with ministers that was something that was extremely important, and they have agreed to take that away. Because, you know, it's important to note that existing health and safety law will, of course, also play a very important role in the weeks ahead in supporting your work. Existing health and safety law applied during the height of the pandemic, and it definitely applies now. Therefore, we would expect employers to be listening and promptly acting on concerns and representations that are being made by union reps around health and safety issues. We also expect, of course, employers to support and actively encourage union members to report incidents which the HSC define as near misses and undesired circumstances. For example, the lack of PPE, concerns about access to cleaning materials or hand sanitizer and so forth, without the fear of retribution, without the fear that you will be mistreated for speaking up in the workplace. As a union movement, we're a team, we're a squad. On health and safety, your role is actually the most important one. And as the General Secretary of the Wales TUC, I support your role by pressing government, employers and enforcement agencies, of course, to act in the best interests of worker and public safety. Wales TUC and union leaders across the whole of Wales have been working in social partnership to make sure that the voice of health and safety reps is being heard at the highest levels, at every single table, at every single opportunity that we have to raise these matters. And we have seen some benefits to this approach. As I've mentioned, we've seen some positive changes to the new guidance as a result of all the hard work of the union movement as a collective and our involvement. But what happens in practice is obviously sometimes a very different story. In Wales, as in the rest of Britain, those who enforce the rules have been underfunded. The Health and Safety Executive and local government have faced huge cuts as a result of the UK government's central decisions to implement austerity over the last 11 years plus. And furthermore, as we've seen in many areas, the powers of the Welsh Government are actually constrained. The Wales TUC is now set to launch a very big debate on what powers the Senedd should have to protect and promote workers' rights. Health and safety law enforcement could be and should be a part of that discussion. Furthermore, we support the Welsh Government's decision to introduce a social partnership and public procurement bill, and this can also, I believe, have the potential to strengthen worker voice on health and safety and other matters as well. When it comes to the question and answers, I'll be really interested to hear about your experiences in particular in relation to enforcement agencies, how it's gone so far. What sort of areas do you think that we need to see some very, bigger improvements on as well? So finally, I just want to thank you, of course, again, for all of the work that you've been doing. This has been an incredible period. We've never seen anything like it. And your work in particular has been absolutely invaluable in protecting workers and the wider public as well. So diolch yn fawr, and I will close my comments at this point. Thanks, Sian.
Brilliant, thank you, Shav. Thanks very much for that. A lot of insights there, I think, into how we're going to deal with the new situation we find ourselves in. And the new guidance from Welsh Government, which came into force on the 7th of August. I'd now like to turn to Doug Russell from USDAW, to hear your thoughts, Doug, on the role of the health and safety rep and how they fit into all of this. And so, Doug, over to you.
Thanks very much, Sian, and good morning to everybody. I've just got a few slides I want to quickly share with people if I can find them. And there we go. Whilst I'm talking. Yes, the role of the safety reps during the pandemic has been a very important and very significant one. It's interesting, isn't it? It's over 40 years since the Safety Rep and Safety Committee regulations actually came into force. And in that 40 years, safety reps had been beavering away quietly, protecting health and safety in the workplace and saving lives in workplaces, but without too much of a presence there. I mean, they were known obviously to our colleagues in the movement, and it was generally recognised by trade unions what a valuable role they did, but they weren't seen as quite as central as reps, perhaps as some other reps were in the workplace. And then the pandemic hit, and it brought home to both employers and workers the importance of trade unions, both nationally in agreeing the procedures and precautions that were going to be necessary in various workplaces, as we just heard Shav describing she's been doing with the Welsh Government, but most importantly also with the safety reps themselves in the workplace, making sure that they used their powers under the regulations to make sure that people were kept safe. And they have had a dramatic effect. All of a sudden, there was a great demand for safety reps. So people wanting to know what was going on. Were the risk assessments that were in place any good? Were they providing the protection they needed? And reps have been very busy working away at all of that. Most of it unrecorded and unrecognised, I must say. Fortunately, however, the TUC did commission some research, which actually managed to capture some of that activity, specifically in food manufacturing, distribution and retail, which were essential services that had to continue through the pandemic, and which were sectors that certainly involved USDAW members, but also members of other unions such as Unite, GMB and Bakers Union. And that research is actually a very interesting piece of reading and worth having a look at on the TUC website. And the link to it is on the slide here. And it says one of the most important roles played by the unions was monitoring the risk amongst members and non-members, ensuring compliance with the regulations and overcoming resistance, or what one respondent called a culture of denial. And that's actually, to me, one of the most significant things that safety reps did. They actually drove the response to the pandemic, which meant that in lots of workplaces, measures were put in place more quickly and more effectively than it otherwise would have been. They've also got some more detailed evidence of the fact that safety reps made a difference in the study, which is very well worth looking at, because it does actually prove that where safety reps work, then things get done better. That's not new in any sense. All the other academic research that's ever been done in the role of safety reps shows that safety reps do make a big difference to health and safety in the workplace, but it's good to see it reinforced by this particular research. Obviously, our members in USDAW work in retail, distribution and food manufacturing, as I said, and we've very much been relying on our reps at the front line to actually implement things, but it's been slightly different in the different sectors. So, for example, in the large supermarkets, because of the way they operate, the discussions were held nationally with the large organisations to thrash out their risk assessments and control measures fairly quickly. But then it became crucially important that safety reps were informed of what those risk assessments were and were able to check that they were being implemented properly in the thousands of different stores across the country and make sure that if there were any local issues, they were being picked up and dealt with as well. By contrast, in other sectors such as the food industry, where there are more individual sites involved, there was more a question of the safety reps actually leading the change to actually make sure that things did get done in the workplaces where it was important that they were done. there's one example in the Greenwich University study for the TUC of a food company where two of the reps described a session they had with a site manager because members were concerned that they weren't working fast enough to implement measures in the workplace. And after what the reps described as a full and frank discussion, and what the manager himself described as a bollocking from the reps, the manager actually then went on to set up a proper COVID activated group, including all the reps on site to make sure that things were done. But it took the reps to actually make that change. And that was very much our experience as well, and experience of other unions in that industry, that often management were slow to react. And it was only when members were actually walking out the door because they were too frightened to actually work in the workplace, or when the grumbling got loud enough, or when the reps actually intervened, that things actually got done in those sorts of workplaces. And when you think about it, it's fairly obvious why safety reps should have been so important in that whole process, because there was a lot of uncertainty and fear around the pandemic, and communication between the workers and the management in all sorts of workplaces was crucially important. And that's something that safety reps are very good at because of all the training they've had and the experience they've had over the years in providing that kind of thing. They listen to the members' concerns, and they can provide very effective feedback to management on the effectiveness or otherwise of the control measures that they've got in place. And they've also got their own experience and knowledge of the workplace, which is crucial to what's going to be practical in terms of implementation of control measures in the workplace. But also, more crucially than that, and again, it's reflected in some of the comments from some of the managers in the Greenwich study, they don't just work on their own. They've got contact with other reps working in other workplaces, other sectors, and other industries in many cases, and they've got contact with full-time officials and with their own union. And like all the other unions, we've been very closely involved with the different governments in the UK where we can to sort out what procedures should be in place. So we've been able to give very good advice to our reps, which has been beneficial in their way they've dealt with their own particular management. And I just want to give a couple of very quick examples of just how that's actually worked out in practice. Tracy was one of our very active reps at Tesco's call centre in Dundee, actually, in Scotland. And she's been very busy throughout the pandemic, dealing with all sorts of issues. One of the first things she picked up on was they were very quick to actually get people out of the office, reduce the numbers working in the office, which meant an awful lot of people being sent home to start to work, and often sitting at kitchen tables in bedrooms in unsuitable workspaces. Where the risks of MSDs were musculoskeletal problems were very significant because they didn't have proper workstations set up to work from. And she did a lot of good work with Tesco's in making sure those problems were dealt with, and in particular, making sure that people were given the opportunity to get frequent short breaks when they were working at home, so that they didn't get that problem, which I'm sure you all experienced as you have been working at home during the pandemic, where you end up sat at a desk for far too long, and then you find you can't stand up because you're too stiff and sore at the end of that period. So it was very important because it's very good, not just for their physical health as far as MSDs were concerned, but also for mental health, which has been another big problem during the pandemic. And the other thing that she'd been more recently involved with was, whilst the main call centre building itself is well ventilated with mechanical ventilation system that brings in fresh air, there were a couple of annexes to the building where the air conditioning systems weren't so good. And she's been able to persuade them to spend quite a bit of money installing new state-of-the-art ventilation systems that will pull in the maximum amount of fresh air in there as well. So she's been very much on top of that particular issue. And the other example I want to very quickly mention is, and Richard isn't alone in this one, it's a very good example of how cooperation has worked very well in the pandemic. Next warehouses, they were very quick to shut down their warehouses when the pandemic first hit, like a year and a half ago. But very shortly after the shutdown, they got in touch with the union reps, including Richard, who actually works at their Bristol depot, and got the reps involved in doing the planning to reopen the warehouses, which they did over the space of the next couple of months. So the reps were very much involved in planning how to actually rearrange the workplace, the flow of traffic through the workplace, how to rearrange canteens, how to make sure there was one-way systems in place, how to make sure that in rooms where previously they'd maybe have 40 or 50 people working, packing at tables, that was spread out so that they were down to maybe 10 or 12 people working in that area, and finding other spaces that could be used so as they could still expand. Because remember, it was a mail order business, so it was actually facing increasing demand at that time, and yet they've managed it very well. But again, crucially, the reason it worked so well was Richard and his colleagues in Bristol weren't just working on their own, but they had links with the reps who worked in the other next warehouses around the country, in Yorkshire and other parts of the country, to make sure that they could share their experience and plan what they were doing. So there are a couple of examples of the kind of good things that safety reps have been doing crucially in workplaces across the country. And as I say, there are thousands of other ones that we just don't know about, often involving protecting individual members who might be particularly at risk, such as clinically extremely vulnerable people or pregnant workers who had a very hard time sometimes with some employers during the pandemic, and dealing as well with those kind of mental health issues and the stresses that people feel, particularly those parts of the sectors where key workers were still working in close contact with the public, facing the risk of problems. What's next with the return to work and with Wales moving to level 0? Managing the return to work is going to be crucial. Making sure those risk assessments are in place and that they work properly is going to be very, very important. Getting past that message that the government was pushing too hard at one stage, that because of vaccination, it's all over and we don't need to worry about it. Using terms like Freedom Day were not particularly helpful, I don't think, because we still need to see those other precautions in place. And that's why it's very good that the Welsh Government has taken the decision to be still quite strong in things like 2 metre social distancing, on people working from home where they can, and crucially for us as a union, also on people wearing face coverings on public transport and in shops. Protecting vulnerable workers is going to be crucially important in this process. And there's a whole mess of something going on at the moment, which I don't have time to go into the detail of, but Shelly might also pick up on as well, which is dealing with the issues around workplace testing and isolation of potentially infected workers. Obviously, if somebody has symptoms, they should still be isolating because it's important that they're quarantined from other workers. But there's also this issue about what to do with people who are close contacts with that person who may not have symptoms, but may still be infectious. And the government's move to actually introduce a policy that says if you've been double vaccinated, it's okay to come back into work in those situations might just be they're bringing more infections into the workplace, which isn't helpful. And then there's a whole sorts of issues around mental health and work-related stress, which are going to be very, very difficult to deal with. And there's all sorts of other issues coming along the horizon, such as the development of hybrid working. And interestingly, that poses us some challenges in organising as well. If people are spending a lot of their time working from home, they're much more isolated, and keeping in touch with them as unions is going to be quite difficult. But more importantly, there's the future. The pandemic, with a bit of luck, will eventually begin to fade away sometime in the middle of next year or at the end of next year. It might actually be something we look back on as something that caused a lot of disruption and a lot of problems, but it doesn't mean that all the other health and safety issues that we have to deal with in the workplace are gone as well. And what we need to try and do as unions is find some way of actually capturing the way in which safety reps were seen as central to the process of managing the pandemic and carrying that forward so that health and safety stays at the centre of the organising agenda. Managers still value the role that safety reps play, and members and non-members understand the importance of the work that they do as well, so that we can tackle those other big occupational health and safety issues that are still going on as the pandemic has developed. Things like stress, musculoskeletal disorders, accidents in the workplace involving slips, trips, falls from height, vehicles and so on haven't gone away. And there's a whole set of other new issues which are becoming more and more important and more apparent around air pollution, around climate change and the need to adapt to climate change, which are going to cause all sorts of other serious health and safety issues in the workplace. And interestingly enough, are ones which also cause public health problems. So they're much more parallel to the fact that the pandemic, because it wasn't just a workplace issue, it was a workplace issue, but it was also a public issue as well. So those are the important challenges for the future, and it's certainly going to be interesting times, I think, going ahead. Thanks very much, Sian.
Thank you, Doug, very much indeed for another very insightful look, really, at the qualitative impact that health and safety representatives have made through the course of the pandemic. And it was great to see the practical examples as well, where change came about precisely because of having good health and safety, union health and safety reps on the ground. So thank you very much for that. I just want to remind everybody that we'll be opening the meeting to you soon. And I'd like you to have a little think, because we want to hear from you. What do you think the role of the health and safety rep should be now moving towards the future? Are there any changes? And obviously you're in a position to have a conversation with our panelists, with Shavanah and with Shelly, and of course with Doug. So before we move on to that, I'd like to introduce our final speaker, Shelly Asquith. And Shelly, I think, is going to address some of the wider health and safety challenges which we're going to be facing relating to COVID moving into the future. So Shelly.
Thanks, Sian. I'm also going to get a presentation up, so just bear with me one moment. Can you see it all right?
Yep, that's on the screen.
Great, thank you. So hi everybody. So the TUC in Wales, TUC has called this and other meetings across Britain because this easing of lockdown restrictions comes with a real risk of loosening COVID safety measures at work. I know a lot of reps are kind of worried about what employers now do, kind of feeling that they've been given a green light by particularly the UK government to throw away some of those COVID control measures. And particularly there's a risk of doing that without the involvement of unions. And as protections on a national level are being lowered, infections are also on the rise. So we think it's really important to bring reps together in this way, find out from you exactly what's happening in workplaces as restrictions are eased so that we can best respond to them, provide you with the best support that you require, and help give you confidence as well to kind of push back on any attempts to water down safety measures. A safely managed transition out of lockdown is the best way that we can protect people's health, protect the economy and jobs, and also protect the NHS. And as the World Health Organization stated early this year, premature and poorly planned reopening of workplaces is likely to increase the risk of outbreaks at work. We are already seeing outbreaks rising again. And this is what the current case rate looks like across Britain. As you can see here, it's lower in Wales compared to anywhere else, that red line at the bottom there, but it is still high. And if the lifting of restrictions in England is anything to go by, it will rise quickly back to those January, February levels, especially once schools go back in September. You already know what the ending of lockdown means in Wales. The important thing to emphasise is that no matter what legal restrictions are lifted now or in the future, employers still have a legal duty to protect your health and safety at work. As Shav said earlier, you know, those existing legislation is really important at this point. They have to reduce risk, and COVID remains one of those risks. It's still a risk because even if you're vaccinated, you can still get COVID, you can still pass COVID on, and you can still get sick from it. And lots of young people, on top of that, still aren't fully vaccinated. Many clinically extremely vulnerable people are being told they'll get a third dose of the vaccine in September. So while they're most at risk, they're also still not yet fully vaccinated. And of course, everyone is at risk of long COVID, which I'll come on to later. And while the Welsh Government has taken more precautions and is consulting with unions, unlike the UK Government, the UK Government is not prioritising workers' safety. It is not prioritising engagement with unions or employers in its latest reiteration of the workplace guidance. We can't expect employers to protect workers' safety either, and the Health and Safety Executive is not taking enough enforcement action to compel employers. And I will come on to talk more about the HSE in a moment. But the point I'm making is it's up to us, it's up to unions, it's up to safety reps. Our unions have to assert ourselves and ensure there is no cutting corners on safety in the workplace. Employers must engage you on any changes made to COVID risk assessments. That's the law. And if you determine that employers' plans are putting people at risk, we'll back you. COVID-19 hasn't gone anywhere, so neither should the safety measures that keep you safe at work. Risk reduction should continue to follow the hierarchy of controls model, layering those control measures. And employers should begin by eliminating the possibility of transmission. I know that the advice is still work from home if you can, but also where you're in the workplace, using engineering controls, changing job roles to reduce transmission risk, and adjusting the environment. Personal protective equipment is a last resort because it is the least effective control measure. In particular, ventilation is a key control measure where workplaces are occupied. I never played a video on PowerPoint before. I'm going to see if this works here. So at last, the government and HSE guidance emphasises the need to prioritise improving airflow indoors as a key step to reducing risk of transmission. Now, COVID aerosols are more likely to build up over time in indoor, poorly ventilated spaces. So employers are now encouraged to purchase CO2 monitors to help identify where those poorly ventilated spaces are in the workplace, and then in turn take steps to improve airflow. So as well as opening windows to get that airflow in and help disperse COVID aerosols, switching off recirculation systems, which just gets the same air going round and round, using upper room UV disinfection, mobile filtration units. These are all additional tools that can be used, as well as kind of opening up those windows. And I will post a link later when I finish to some more kind of in-depth advice on ventilation, because none of us are engineering experts. We're all learning, but it's absolutely key that employers are taking action in this way. And despite it being one of the most important control measures, ventilation is still one that reps tell us fewest employers are doing anything about. So it has to be unions forcing it onto the agenda in those safety meetings and forcing it onto the risk assessment. There we go. So our own polling shows that over time, workplaces have become safer, but there's still a long way to go. People do feel more confident about safety measures, but it's only going up very slightly. That is in large part down to unions using our reps, using our committees, negotiating and taking action to make employers improve safety controls and make work safer. But as workplaces reopen, this may not be so much the case. And disabled workers are the least likely to feel safe at work. Many of these will be considered by the NHS clinically vulnerable, clinically extremely vulnerable. They should be getting individual risk assessments, particularly where they're returning to work for the first time. People should be being referred to occupational health where necessary. And while work from home guidance still stands, if people are at high risk, then all the more so they should remain working from home. And I should also mention that clinically extremely vulnerable people, and indeed anybody, still has the right to request to be furloughed. We also know that a high number of COVID cases means a high number of people are told to self-isolate, and that means many, many workers make to survive on just £96 a week statutory sick pay. Even with the self-isolation payment, many are at a severe shortfall compared to their usual income while self-isolating. And as you can see here, 20% of workers say they simply cannot afford the time off. We know from other union research that some workers have simply carried on working, even when they've been told to self-isolate, even when they've even tested positive with COVID, at risk to themselves and of course others, because they have no other choice. If they want to avoid debt, if they want to keep feeding their families, they have to continue going to work to get an income. It is an impossible choice, and this government, frankly, is responsible for forcing people into those choices. The TUC has repeatedly called for statutory sick pay to be at least trebled to the living wage so that people can afford to live on it while they self-isolate. And it's a demand that we continue to make. But in the meantime, in workplaces, we can continue organising for better company sick pay and for parity. For example, for agency workers, where you may have them in your workplace, to be brought in line with in-house staff on company sick pay schemes. I mentioned briefly long COVID before, and it is still an illness that we don't know everything about. We're still learning more and more all the time about it, but existing medical evidence shows that symptoms are similar to illnesses like chronic fatigue, with symptoms lasting up to or even over a year. A third of people in a TUC piece of research that we did, we surveyed over 3,000 workers with long COVID, said that their symptoms have lasted that long. Research shows that long COVID doesn't discriminate necessarily on the basis of age, although more women seem to be affected. People tend to suffer symptoms like brain fog, tiredness. These can significantly impair someone's ability to do their job, and particularly to do it safely. And more than half of those surveyed said that their employer doubted their symptoms were real and they've faced pressure to return to work before they felt ready. So unions need to be working to support people with long COVID by negotiating with employers a phased return where that's appropriate, occupational health referrals, adjustment, and also just respect and understanding that long COVID is real and the symptoms are serious. And getting people to provide GP letters may help convince employers that they need to be doing something to support people. On a national level, we're calling for long COVID to be recognised as a disability so that workers have equalities protections. And we also want it recognised as an industrial illness where COVID was transmitted in the workplace. That could end up giving people financial support in the long term as well. Again, at the end of this, I'll link to our report and the petition calling for long COVID to be recognised as a disability. Now, another poll that we carried out on workplace safety, it shows that there's still a majority of people telling us the most basic safety measures are not in place, with more than 60% saying that they're not even aware of a workplace risk assessment. This is much more so the case in workplaces where there is no union. In fact, other research that Doug referenced there that we've carried out during the pandemic proves that workplaces with unions have better measures in place and they are safer, but too many workers are still not in a union, and that's where the majority of problems that we're seeing. And a large part of the problem is when employers do fail to control the risks to workers' health and safety, the regulator that we rely on is taking very little action against them. Despite thousands of weekly outbreaks, what we know about the breaches from the polling, the health and safety executive, the regulator in most workplaces, has issued fewer than 500 notices to employers asking them to improve their safety regimes, and it has issued a total of 0 prosecutions for serious breaches over COVID. You can see from the graph on the left here the average number of enforcement notices issued. Now, this is from last year. The rate of enforcement notices issued is well below the average for previous years. So in a year of a pandemic, the HSE is issuing fewer notices to employers than it would in any other given year. And I also want to say something about riddle reporting of occupational exposure and deaths of COVID, because the graph on the table on the right here, you can see from our report the number of working age deaths and the number reported to or investigated by the HSE. Employers, frankly, are being let off the hook. Families are being denied recognition and justice where somebody was exposed to COVID at work and later died from it. We'd encourage reps to self-report and backdate reports of occupational exposure where needs be. So without a regulator willing to take necessary action on employers, it's up to us. Unions are the most likely place that people go to with a concern. As you can see here, 16% say that if they've got a concern about health and safety at work, they'll speak to their union. Twice as likely to speak to a union as to the regulator whose job it is, frankly, the HSE here, and much more likely to speak to us than any other kind of body. However, the most alarming statistic is that half, right at the top there, don't know where to go. If they've got a health and safety concern at work, they don't know who to turn to. So that is a message to us that we obviously need to recruit many more people into unions, but we also need to be much more visible, much more active, much more vocal about our role, the job that we're doing to protect people's health and safety. And now there is inspiring action that's been being taken throughout the pandemic over the last 18 plus months over COVID. And I just wanted to share a few examples as I get towards the end here of where workers have taken action. And I want to also echo what Sian was saying at the beginning there, a massive thank you to the safety reps who've had this on their agenda since day one, who in many cases have gone above and beyond, putting in many, many hours of work, particularly unpaid hours, to protect themselves and their colleagues. And it's not always about walking it off the job and taking industrial action, but through negotiation and through pressure on employers, people have managed to improve sick pay, safety regimes at work, getting clinically extremely vulnerable people out of the workplace. The list goes on. So a massive, massive respect and thank you to those safety reps who've been doing that. Just a quick summary of what needs to change. Now, I talked about ventilation at length, and I will share some resources with you, but that is a key control measure. As people are going back into the workplace, it can really improve, will reduce the risk of COVID transmission in indoor workplaces, as well as making sure that everybody has a risk assessment and has access to it. We want to make it a legal requirement that employers have to publish their risk assessment on a website, on an intranet, anywhere, to make sure that people can access it, that employers are accountable for their safety regimes. I mentioned sick pay. We need to make sure that statutory sick pay is at least treble to the living wage, but in workplaces, we can also lobby to improve company sick pay, introduce company sick pay, make sure that everybody in the workplace has access to it. And finally, on vaccinations, we know that they're a key part of beating this virus, but when it comes to people having them, we need to make sure that people are supported to get vaccinated, not coerced into it, not forced into it. And that means employers should be giving people paid time off to go to their appointments, and also paid time off if they have to take time off for any side effects. And we know that some people are experiencing those side effects for 1 or 2 days after. They should not be penalised with pay cuts for doing so. And finally, just a message to say, unions make work safe. We know that. We need to make sure all workers know that. So get out there, make sure that employers aren't cutting corners on safety, get people in the union. And thank you very much. I'm looking forward to hearing from you guys and what's happening and what your concerns are and the kind of actions you're taking that we can best support you going forward. Thanks, Wales TUC, for organising this meeting.
Thank you very much indeed, Shelley. Huge amount of information there. One of the things that becomes very clear, I think, is that the effects of COVID will be with us in so many ways for so many years. And the challenge of keeping workers safe in the new conditions is enormous. Unions, of course, will be the main vehicle of fighting to ensure that lessons have been learnt and that workers and the public are better protected in future. We know that there will be inquiries into what deficits there were, but we need to be on the ball, we need to keep pressurising, and we will deliver for working people. Okay, great. We've got about 20 minutes for questions. I have a couple already come in. If you could indicate, please, by raising your hand, that would be very helpful. I've got a question here. We've highlighted to management the problem with fresh air in an internal office. We have air conditioning, but it doesn't draw in fresh air. We've waited months to get a new system. What can we do to speed this up? Shelley, perhaps you'd like to take that one on?
Yeah, I'm happy to. Whoever's asked the question is absolutely right to recognise that an aircon system that doesn't bring in fresh air is bad news, and it shouldn't be being used if it's kind of drawing the same air around the workplace. I mean, the most effective way to draw in fresh air is to open windows. But as you know, we're in summer at the moment, and that's fine. But as we, you know, the air tends to get cooler towards the end of the year, it's not necessarily safe to have all the windows open, people chilling at their desks or wherever it is you're working. I mean, the best way to speed it up is to get members together, discuss the issue and work out what kind of action you're willing to take over it. It sounds like negotiating with the employer and kind of asking them repeatedly hasn't worked so far. So, you know, speaking to your union officers and finding out what kind of action might be appropriate sounds like the best route of action. I mean, it might be worth sort of saying that you're going to make a report to the HSE if ventilation, you know, isn't adequate. You know, there might be a breach there, but certainly I think getting members together and seeing how you can escalate that is probably the best source. I will post a link to some more advice on kind of the things that employers can be doing to improve ventilation, because it isn't just about you know, that those sort of systems. There's other things they could be purchasing which are a bit cheaper and might be sort of stopgap for the time being. But I always say that union action is the best way to get the goods.
Thank you, Shelley. Can I bring Shav in at this point? Because I know you'll have a Wales-specific take on this, Shav.
Yeah, so I agree with what Shelley has said about getting people together and having that discussion, because that's how, you know, we've seen the dispute in the DVLA, and that's kind of how that started, where reps, you know, were getting a series of different complaints. People were getting really sick. People could actually see that things were wrong. And there became like this a bit of a, you had those people who were physically in the workplace and those people who were working from home. So it became a bit of a confused space. So the sooner that they got themselves organised and started sharing information, that was really, I would say, the starting point is when things actually started changing. The other thing that we can do, because of the fact that we have got a National Health and Safety Forum for Wales, where we have Welsh Government, the trade unions and the Wales TUC around the table with employer organisations and the enforcement agencies, including the HSE, there is a formal mechanism for us to be able to address some of these issues. So if it is a Welsh workplace, there is a mechanism whereby we can formally submit complaints. And I'll be honest with you, the type of relationship that we have with ministers in Wales is very different. So if things are extremely bad, there's always the opportunity of picking the phone and getting something done. So there are ways and means of getting things moving a bit quicker. That unfortunately doesn't necessarily always happen in England, but especially if it's an organisation that is funded, whether it's directly or indirectly by Welsh Government as well. But they are things that we can do from the negotiating end too.
Thanks, Shav. Another question that's come up from somebody who works in hospitality and says that their company wants them to be tested every week. Is this good practice? Doug, do you want to take that one on?
Yeah, as I said, testing is one of those difficult questions in places like hospitality where there's lots of contact with the public. It's quite interesting. In general, if they're being tested every week, I presume that means lateral flow testing, which they'd be doing themselves. And in general, we're in favour of workplace lateral flow testing. In fact, in lots of organisations in healthcare, for example, people are doing it twice a week already as a standard practice. It's important, however, to realise there are limitations to those tests. And in particular with lateral flow tests, a negative test doesn't mean that you're completely free from infection. Because the test is not a very accurate one, a negative test isn't a guarantee of that. The point of doing the test is if you do test positive at the lateral flow test, that means it's very likely that you are infectious and you know you need to isolate and get yourself a PCR test and do the necessary from then on. So as long as it's very clear what the purpose of the testing is and people understand that a negative test doesn't mean you're completely free of the problem and it's safe to go on, then that's actually probably quite a good practice in those kind of workplaces. And also it's very important to bear in mind that testing isn't a substitute for all the other things such as social distancing, wearing of face coverings, and hand hygiene and all the rest of it.
Thanks, Doug, very much. Shelly, Shav, either of you want to add anything to that?
I think Doug's spot on with that. I would also just say, you know, if employers introducing a new scheme for testing, then they should be speaking to the union about how that's going to work, and you should be involved, you know, in consulted in that. I mean, you should also be informed as a safety rep if, you know, if there is a positive case.
Thanks, Shelly. Okay, Kathy is in Scotland. Welcome, Kathy, Croeso Cymru. What Kathy would like to know is whether you can confirm, and I don't know whether it would be Shav or Shelly or indeed Doug, whether the keeping to 2 metre distancing in workplace, oh, it's one for Shav, is regulation or guidance in Wales?
So this has now moved to guidance, and instead what people are supposed to be doing is if you can't kind of do the social distancing formally in the way that you did previously, then there has to be other mitigation measures in place. So you've got to have face coverings. There should be a testing regime. There should be a very good hand hygiene and cleaning regime taking place in the workplace as well. But also, of course, in Wales, we do still have the encouragement from the Welsh Government for people to continue working from home when they can work from home. And they did actually set themselves a target of that then linked back into the wider target around climate change of having a 30% reduction in the number of people who were physically, you know, keeping at least 30% of the population who can work from home to continue working from home for climate reasons, but also in order, as a result, to keep people safe in the workplace as well. So there are slight nuances here. But again, what I would say to people is that if you as an individual feel that because of the fact that you have not been vaccinated, or you may be around other colleagues who feel nervous because they've returned to the workplace, and actually you feel that social distancing is appropriate for you as an individual, the overall workplace risk assessment does not mean that you don't have individual needs. So your individual needs also then need to be protected and honoured as well. So there is the individual risk assessment toolkit that was developed and that we were involved and the unions were involved in developing here in Wales. Originally, it was developed because of the high numbers of Black and minority ethnic staff that we were seeing being impacted in health and social care settings, but then that was widened to include all staff. So there is that toolkit that is available. And there's a range of different, you know, alternatives to that. But I would say that if that's something that the individual feels is important for them, then that's what should be happening as well. And again, with face coverings, what we have to remember is if people are physically returning into the workplace, it might be that they need particular types of PPE because of the fact that they're vulnerable. You know, a normal face covering may not be appropriate. They may actually need a proper, medical grade mask, for example. So those individual needs are also very important. This is not just about a one size fits all approach.
Thanks, Shav. We've got some questions coming in. We've got one here. If the employer's risk assessment for a cafe states staff will wear masks, can the staff refuse? One for you, Doug?
Tricky one, isn't it? Because it's well, in large parts of the UK now, it's not going to be compulsory to actually wear masks in those sort of situations. My answer would probably be that if you are able to wear a mask, however, you should still consider doing it, and if that's part of the risk assessment for the employer. Clearly, there'll be some people who will be exempt who can't wear masks for valid reasons, and that should be recognised in the policy as well. As Shav said, there's all sorts of needs to take care of individuals in this situation. But if you can wear a face covering in that situation, it's actually, I don't understand why you wouldn't, because it's a social responsibility. It's not something, you're not being forced to wear it to protect yourself. You're being asked to wear it because if you wear it and you happen to be infectious without knowing it, it helps to stop aerosols and droplets being breathed out by you so that you don't pass the infection on to others. So it's our social responsibility to wear masks in those sort of situations. And we've had issues in some workplaces where there have been problems. In distribution, for example, in warehousing, where people are picking at tremendously fast rates, and although there was some relaxation of that at the beginning of the pandemic, the pressure has crept up again for them to start picking very hard. It's physically strenuous work, and people don't like wearing face coverings in those situations. And the union has had to actually be involved in those discussions along with the management to explain to people why it is important in some situations to continue wearing face coverings in that situation, and convince people it's actually necessary to do so. But that can only be done where there's proper consultation and discussion between the union reps and management, and there's an open discussion around it.
Thank you, Doug. Another question. I want to try and get everything in before we close. So a question from Carol. The BEIS guidelines state that people should avoid close contact. So wouldn't it have been better to keep the 2 metre social distance? Shelly?
That's a great question. I mean, yeah, in a word, it would have been better to have kept social distancing. I mean, as Shav said, like social distancing, 2 metre distancing is still guidance in Wales. And so where it's possible, it should still be being adhered to. There's obviously a recognition that in some workplaces that isn't and has never been possible. And so you have those layered controls, you have like extra mitigations to account for that. The government, like the UK government, you referenced the BEIS guidance. Unfortunately, there was very little consultation with unions. There was not even any consultation with employers on what kind of like legal restrictions were going to be dropped. And so, we had our own opinions on how that should have been managed. But it still stands that if it is guidance, where social distancing can be adhered to, it should be. And where it can't be, there should be additional measures in place.
Thank you, Shelley. Thank you very much. And yes, I think the answer to that is a resounding yes. We have Katrin Williams. One for you, Shav, I think. Katrin says, cannot see any other way of keeping workplaces safe than maximising working from home, good ventilation, 2 metre social distancing, and good hygiene measures. The enforcement is key, and we have only had one site inspected, and the assumption was that the DWP, as a government department, that everything would be fine. Without mandatory measures, how can we beef up enforcement in Wales? This is a biggie. Shav, I'm going to pass this one to you.
I totally agree with the comments that Katrin's just made. Enforcement has been an interesting one for us here because when the National Health and Safety Forum was first set up, we weren't sure that we were going to get HSC around the table because it was Welsh Government that was setting up Health and Safety Forum. So one of the things that we did was in the background was actually to talk to some senior reps, PCS members and reps in the HSE in Wales to say, if this was to happen, if there was to be a request, would your managers refuse to be involved in, such a structure because it's the Welsh Government calling for it? And it was really helpful having those discussions because it made it a lot easier to get them around the table. But nonetheless, the fact of the matter is that the Welsh Government doesn't directly have control over enforcement. But I also think that sometimes maybe it can come across as a bit of a get out, because they do still have the environmental officers that come under their control as far as government is concerned. And it's not as if we have had, there hasn't been any employer that has been fined or taken to court or anything like official happened to them, whether that's a government organization, department, or otherwise. So either which way, sometimes it does kind of feel like we dance around the issues and we're not dealing with them. And the approach is always, rather than enforcing, we should encourage people to do better and have those conversations. And that's all fair and well. And I think that's important. But, there's been, and Sian, this, and we've spoken about this publicly, about the amount of polling that we did independently, which clearly demonstrated that regardless of the fact that we had these regulations in place in Wales, employers, the maximum number of employers were not conducting risk assessments, whether they were, collective workplace risk assessments or whether they were individual ones. And there definitely wasn't, enough, there wasn't any enforcement. And we know, from, I think, was it one of the last UK government advisors, enforcement advisors, who said that even when it came to minimum wage, it could be God knows how many hundreds of years before an employer is likely to get someone come and knock on a door and do a bit of a site inspection to see if people are getting paid the minimum wage. So why would we think that something like health and safety would be given the level of priority that was clearly needed? So I think this takes us back to the bigger conversation now, which is around a public inquiry. And, the public inquiry that is set, we understand, to take place potentially spring next year, for the UK government is possibly looking at. There's been discussion about whether or not Wales and the devolved governments also need to have their own. And equally, people are saying, should there be an independent public inquiry that is for the people? So it's going to be very interesting to see what happens with that. But the enforcement agencies, they have had impacted by cuts. They haven't had the right level and number of staff that they need, and experienced staff as well. Because yes, they did get some additional money during the period of the pandemic, but it does take some time in order for you to get up to speed. And we weren't having the physical actual inspections either. So one of the things that we asked for, if you remember as well, is that we wanted to have, like was agreed for Ireland, is that health and safety reps should be able to be roving health and safety reps. So they should be able to go into a range of different workplaces to conduct those inspections, particularly as we started to come down as far as the stages, of the restrictions were concerned. And that still hasn't happened. That hasn't happened, in Scotland. It hasn't happened in Wales. It hasn't happened in England, of course. But, it sometimes it can be extremely disappointing. There is so much more that we can still be doing. And I just feel like the way that you can actually impact and force sometimes the hand of those in positions of power is by organizing in the workplace, making sure that we are recruiting and building the union movement around these really important issues of health and safety, and bringing, talking about it in a very accessible fashion in the way that we have been. And but yeah, in a roundabout fashion, I think that there is so much more that can be done.
Okay, we've got one more question, which I'd like to ask you to take on before I close the meeting. And this is from a colleague who, Jan, works in a university and worries that many students, particularly international students, won't be vaccinated. Jan is at high risk, but she's double vaxxed. So really, I think, Jan, this is a question of how she should deal with that situation.
I don't know if Shelly or Doug want to come in, and I'll...
Yeah.
I think it's really tricky regarding vaccination. And I have to say, I don't know what the university unions are saying around students being vaccinated. I know in other countries, you're not allowed to enroll or start your course at university if you haven't received both doses of vaccination, but it becomes a bit tricky with international students because different vaccinations are recognised by different countries or not. So in terms of that, I'd say, you know, the union should be fiercely negotiating with the university as the employer about what the rules are about students starting whether they've been vaccinated or not. But as I say, I don't know what the unions are saying on that nationally. But in terms of Jan's position as an individual, if she's at higher risk, then she should be demanding, or the union should be demanding on her behalf, an individual risk assessment to look at what her particular needs are and what you know, mitigations can be put in place to protect her in the workplace. As Shav said earlier, it's not a one size fits all. Some people are more vulnerable than others. And you know, if you're in a Welsh university, there is still a recommendation to work from home if you can, particularly if you're politically extremely vulnerable. Getting a letter from your doctor to kind of back you up might be of assistance as well, in kind of that discussion with your employer. But certainly making sure that the university is taking every possible step to keep you and your colleagues safe, particularly distancing you from students, whether or not they've been vaccinated. If online learning and that kind of thing, I don't know what her role is, if she's even a teacher, but if that can be put in place, and negotiating for that, but certainly making sure that you've got that individual risk assessment and all the measures that can be put in place are to protect you. I'm sorry that I can't say much more about the vaccination issue. Perhaps other colleagues can.
Just on the point of getting a letter. So when the levels changed, what we were advised by ministers is that every single person in Wales who's classed as clinically vulnerable should actually have automatically received a letter in the post to advise them on the changes to the regulations and how that they may be individually impacted. So that's definitely worth keeping an eye out for. And if you haven't received such a letter, then get in touch with us and we'll see if this is a bigger issue or not. But I haven't yet seen a version of such a letter, so I'd personally be quite keen to see what the contents look like as well. Just if anyone has got one, that'd be really helpful. Cheers.
Thank you, Shav. Thank you, Shelley. There's a comment here from Carol, our closing comment. About long COVID, and I think it's worth addressing, although, I know that we are a minute over time. Shelley mentioned that we want long COVID to be recognised as an industrial disease, but to be RIDDOR reportable, people need to complete accident reports. It would be really useful if the TUC could put out guidance on long COVID that starts with reporting at the workplace. And I think, Shelley, Shavanah, we'll be doing our very best to do that. Carol, keep an eye on our websites, because we will be providing that information to our health and safety risks. And of course, we're here available to you for individual queries as well. Okay, well, can I thank our panelists, Doug, Shelley, Shavanah. I think it's been a really useful discussion, a really, really useful discussion. And I hope that it's provided everybody with a lot of food for thought, particularly in terms of what the union response should be as we move forward. Now, generally, this would be the point at which I wish you a safe journey home. But I think in most cases, that's no longer necessary. So thank you very, very much for attending. We have recorded the session today, and that will be made available to you. And I believe that my colleagues will also send you out the presentations that were given. So thank you very much. Bye-bye now.